Hello, welcome to our special Nurses Week as well as our National Teachers Day broadcast. I'm your host, Syl Trepanier, Senior Vice President and System Chief Nursing Officer at Providence. As a reminder, the information provided during this event is for information purposes only. So if you have any medical questions, please reach out to your primary care or healthcare professional. So now let's begin. Joining me during this live event is Dr. Melissa Robinson, Professor and Division Chair for Nursing Programs at University of Providence, and Dr. Ron Lombard, Associate Professor of Nursing at the University of Providence in Anchorage, Alaska. Thank you so much for both of you for joining me. Let's start with a little bit of introduction. So Dr. Melissa Robinson, why don't you give us a little bit of introduction, please?
Thank you, Syl. Thanks for having us. So my name is Melissa Robinson. I am the Division Chair for Nursing at the University of Providence, and I've been a nurse and actually part of the Providence health system since like 1991. So I'm a proud Providence caregiver and an educator. So I've been teaching in nursing education as well since about 2006. So I'm super excited to talk about our programs and very grateful that you've asked us to join you. So thank you.
No, absolutely. Ron, welcome. Why don't you tell us a little bit about yourself?
Thank you so much for asking me to be here today. My name is Dr. Ron Lombard, and I'm the Anchorage Site Coordinator for our Accelerated BSN program through University of Providence. My background is primarily in emergency nursing and then nursing education. I've been a nurse since 2006 and been teaching full-time since 2010, and still worked a little bit PRN as well during that time. But I have been in Alaska nearly 3 years now. I came up to work and start teaching up here and had the opportunity to collaborate with University of Providence to open our accelerated BSN program in January of 2020. So I've been with that program in our about 2 years now. It's our second cohort, and we have 18 students currently in the program and are getting ready to enroll for our third cohort. So continuing to grow and excited to be here and talk more about our program today.
Well, thank you. Thanks so much for being here with us. Ron, I'm going to start with you. Why are you so passionate about nursing and education? And maybe tell us a little bit about your journey and what led you to being an educator, nursing educator at that.
Sure, thank you. In nursing, I'm most passionate about being in a profession where I'm really just trusted to provide care to individuals. Nursing is such a unique profession where, as a nurse, we get to bear witness to those who need our skills and services at some of the happiest moments in their life, but definitely at some of the most vulnerable as well, right? We get to be with patients during exciting times, such as welcoming new babies into the world, seeing children grow throughout their lives, educating about wellness, but we're also there during those tough times as well, from injuries and traumas to surgeries and even those unfortunate moments where patients do pass away. As nurses, we have to be quick thinking, compassionate, and able to adapt at any moment's notice to the unexpected changes that can arise in our daily routines. We must know how to interact with all members of the care team and serve as a leader or team captain, if you will. These aspects which I'm most passionate about in nursing are also what drive me to be a nurse educator. As an educator, it's my goal to teach the nursing workforce of tomorrow in a high quality manner, which fosters nurses to become safe care partners who are able to use critical thinking and clinical reasoning in their daily practice. In my teaching, I use a scaffolding approach where I find and build and instill strong fundamental base for nursing students. This fundamental base is grounded in safety, altruism, and beneficence, while encouraging them to use their voice to be the patient's advocate and improve the quality of care that is delivered to the patients that they serve. So I'm really just passionate about, really making a strong nursing workforce for tomorrow who are going to serve, us as educators and future patients as well. So it's just an amazing profession to be in and teaching in.
Well, thank you. Thank you so much. Thank you. You definitely are. I could tell, I could feel the passion in how you're describing this. And it sounds like you've been on an amazing journey. And I thank you for answering the call the way that you are. So thank you so much for that.
Thank you.
Melissa, Can you tell us a little bit more about the University of Providence, the programs that you offer, more specifically in nursing here as we are entering our Nurses Week? And maybe if you could weave in there, what's unique about the education program offered at the University of Providence?
Absolutely, I would love to. You know, the programs at University of Providence are so great. I always say I have a pretty good gig because I get to attend events like this and join groups across the system and out in the community where I get to brag about the programs. And so that's a pretty good gig, I feel like. So thanks for asking. The University of Providence is unique itself because it's actually physically located in Great Falls, Montana, which is kind of rural central Montana. Not so much rural right in Great Falls, but it is central and surrounded by a lot of rural communities in Montana. And we have two schools within the university. We have the School of Liberal Arts and Sciences, which is there in Great Falls. And then we have the School of Health Professions, which is largely online and at a distance. And then a unique feature for nursing is that we have a site in Anchorage, Alaska, where Ron does our program. And then we have a site also in Lewistown, Montana, which is a little bit away from the main campus in Great Falls, but also kind of in rural central Montana. So that's also very unique that we have a virtual online program, but then we have these sites. So it's kind of fun to explain that we have this variety available to us. The School of Health programs doesn't just have nursing. We also have some health programs that complement what we offer for students and certainly caregivers in the health system as well. We have medical assisting. We have a master's degree in healthcare administration. We have certificates in community investment and so forth. So we have some great health programs in addition, which draw a large number of students to the programs. And then specifically in nursing, we have the BSN program that I described in Anchorage and Lewistown at those two sites. And then we also have a very robust RN to BSN program. That program is online, and it's actually our oldest or most long-standing program. I don't know if it's the oldest, that's the best way to describe it, but it's been around for about 12 years. And we have several nurses. We've had over 1,000 Providence nurses go through the program and graduate with a BSN. And those are nurses that are working and balancing school as they return to higher education. So that's very successful as well. And then just in the last few years, we've added graduate programs in nursing. So we have a master's in nursing education, which is a 12-month program. Again, that's offered to nurses that are licensed and working and want to move into higher education or move into nursing education, and we hope they do, either to join us in academia or also to serve in areas related to staff education or communities related to patient or group or community education. So there's a variety of ways that nurses can advance in the education degree program. So that's been fun to start that program and see those nurses come back and really thrive. And then most recently in January, we started an adult gerontology nurse practitioner program. So we have our first 20 or so students in that program that have started. And that program is 24 months. And we're excited about that program because it's meeting a need in the community and in the health system related to aging and related to the gerontology population. In fact, yesterday, Providence hosted an outstanding a symposium on aging-focused care. And those of us listening in and watching, and you were there, Sil, sharing your wisdom with us as well. We got pretty excited and just flew into sort of creative mode for how we can integrate that model into our AGNP program. So those are the fun things that are going on, and we're super excited if people want to reach out to us at any time to talk about our programs. So thank you.
Now you bet. And you know what I really appreciate, which is another uniqueness around your program. You just shared with us that here you were listening in on a national platform about evidence-based, a new evidence-based model that's emerging on how to best care for our older population, using the framework of the Institute for Healthcare Improvement, for the that we actually talked about the other day, which encompasses the 4M, if we want to be purist, and then within Providence the 5M. But nonetheless, what I'm hearing you say is, here we were listening in and assimilating new knowledge, and boom, we've turned around and we're now already thinking about how we are going to make sure we make the right changes in our in this particular program, gerontology, for instance. So implementing evidence-based practice as you are learning it, something very unique for you all to be able to move that quickly.
Yeah, and that perfectly unique. That's the perfect description. The other things, it was interdisciplinary, so it was a collaborative way of thinking, and so those are all concepts that we want our nursing students at all levels, at the BSN, RN to BSN, and graduate levels, to really take in and continue to practice with, and so and as well as evidence-based practice, which you mentioned. So that is probably, I would say, since coming to the University of Providence, one of our most unique and exciting opportunities is that we get to be sort of on the cutting edge of what's going on in practice, and then we can follow suit with curriculum development and bring those things into the classroom in ways that inspire us to keep doing it, and stay current, as well as serve patient populations across the states. So thank you.
Yeah, that's awesome. Ron, I'd like to go back to BSN students. Many moons ago, actually, my very first opportunity as an educator was to spend time with BSN students in the clinical space, and I will always cherish those days. There is something really special about the ability to be able to be part of the journey of a new nurse, particularly those BSN students. I'd like for you to share with us a little bit about how that experience has been for you, and maybe kind of weave in today's students. What do you hear from them in terms of the why they chose this particular profession? What are they telling you, and what are you seeing, and what do you make of that?
Yeah, that's a great question. I've worked in education, like I said, since 2010, and I've taught literally from the associate degree level, even LPN students, all the way up through doctoral level. And so, one of the common themes that I always hear is, a lot of nursing students want to go back and help people. I'll talk more about that in some later questions coming up for sure about, helping and what that means as a nurse. But a lot of the students that are in this program are unique in that they have healthcare experience already. And so they're wanting to further that healthcare experience and get into nursing because of so many different career paths that you can take as a nurse, right? As nurses, we wear many hats. We can work in preventative care, we can work in acute care, we can work in educational systems, we can work in nurse academia. So it's really unlimited what nurses can do. And with their prior healthcare experience, so many of the students that come into this program are really able to take what they already know and apply it into the nursing program and grow even more as a healthcare professional. What I think is really cool about my program right now with my students here is I have about 3/4 of them already have healthcare experience, and then about 1/4 who don't. And the ones who have healthcare experience are really awesome to help mentor and teach and guide the other students as well. So it doesn't feel like I'm the only teacher in the classroom. it feels like we really have a collaborative learning environment. And those other students who don't have healthcare experience, while they were nervous coming in, they've really made a strong cohort of a team up here. And they learn from each other. The ones who have healthcare experience, are often kind of set in their ways. I've already seen this, I know how to do it. But the other students then say, well, hold on, you may have done that as a different role, but this is how, nursing does it. And so they all help each other and learn from one another. And I think the biggest reason most of the students are in this accelerated program is the short amount of time that they can develop into a nurse and go right into that healthcare workforce as a nurse, and then just really wanting to expand their career pathways and opportunities, as a future nurse. I think that's the biggest reason up here. Yeah, for sure.
Those who are coming from a healthcare background of some sort, where are they coming from? What exactly have you been up to?
Yeah, I have quite a mix up here. I've had students who were prior surgical technologists. In this cohort, I have lactation consultants. I have a nutritionist. I have a couple social worker backgrounds, and I have a flight paramedic. So just all types of different backgrounds, prior PCTs, or nursing assistants, depending on where you work and what the title was. So lots of just unique backgrounds. I have a respiratory therapist in the program, and I know for next year, we already have a couple physical therapists as well that are interested in coming back. So it's really unlimited how they hear about the program and decide to go back into nursing, but definitely great array of backgrounds and experiences that really help everybody learn collaboratively.
Yeah, the richness of that, right? The fact that they can all bring experience, and that you acknowledge that experience even in this conversation today, and I hope that that all the students really understands how fortunate they are to be able to be in a cohort where there's so much different thinking coming in, and the ability to really help them grow and become collaborative healthcare partners in their journey. So kudos to you, and what a great opportunity for them. That's pretty amazing.
Yeah, absolutely.
Melissa, maybe getting back to you here, from your perspective, your personal experience, what are the biggest challenges you see as a nurse, professor, educator today?
Mm-hmm. Yeah, there's a need. There's such a critical need for more nurses, and so trying to keep up with the demand for the workforce demands really, and also there's pressure there somewhat to increase enrollment. Because we know as nurses, that have come from practice, and as leaders, we know and understand the demands in the workforce for just literally nurses, qualified, caring, compassionate professionals that can serve the need. And so trying to balance that need for nurses that can be ready to be employed and licensed with sort of the resources that are available in higher education for nursing education. And, nationally, and we all know we're in a pandemic, so that's increased or heightened sort of all of these issues. But just nationally, higher education enrollment kind of fluctuates, and it's taken a dip in recent years. And so that impacts the overall availability of resources within institutions like ours, but we share that in common with other institutions. That's not uncommon, I should say, since at least I've been in academia, and so that's part of it. The other part of it is making sure that we have qualified faculty available to teach. And people like Ron, who are willing to live in Alaska, which is beautiful. I can't wait to come visit. but those qualifications that are, very specific, and that passion that you're drawn to academia, and that's where you want to practice, that, that's a specialty in nursing, like other specialties. And so it takes that preparation. You heard me mention that we have the master's program that's focused on nurse education, because there's a need for that just nationally, for programs like that to prepare us to be in academia, and then to stay in academia, so that we develop that expertise, and so that we're continually able to move students through in a quality way with curriculum that's up to date and those kinds of things. So nursing schools, especially pre-licensure programs across the country, have way more applicants, far more applicants than we can serve. And so we turn students away that are qualified. And that's hard to do for those of us that are super committed to serving practice, but also when we know we have qualified people that deserve a spot, we have to have limited numbers in order to serve them well. Not just serve them, but serve them in a quality way. And so I think that balance of need versus resources is a challenge, and probably the most significant in leadership. And there's other factors that play into that. Coming up here in the next 5 to 10 years or so, a lot of our very experienced nurse faculty in academia, they're going to be retiring. And so, we have to have really strong succession planning for bringing those students into programs of higher education, and then really getting them precepted experiences where they work with educators like Ron, who takes his share of preceptors for education, so that they also develop that passion and then want to stay. And so succession planning in all areas of nursing, we know, is critical, but academia is certainly no exception. So I think that's probably the most looming question, or sort of challenge. Another challenge, which is also an opportunity, which we touched on earlier, is just making sure we're keeping up with what practice requires and what's happening clinically, and in the community related to social issues, public health issues. Not all nurses are going to practice in acute care. We know about 50% of them do, but then also making sure that we're balancing those needs for what's going on in acute care, but also with what's going on in long-term care and community-based settings, where population health has become a real focus. And we know that also because of public health currently being so significantly affected by the pandemic. And so, I tend to teach a lot of public health classes, and so I know we're all public health nurses, but we also have to bring that variety into the classroom so that students get exposed to up-to-date information and content that will serve them no matter where they work. So that would be the other challenge. And luckily, we don't do this alone. We do this collaboratively with our practice partners, but also with each other when we work on teaching and education teams. So I rely on the team for that, for sure.
Thank you so much, Melissa, for sharing those challenges. There are big challenges. They're big boulders. Yeah. But I know that you are, just the fact that we can name them, that we can find solutions for them, and we can all lean in and assist. Ron, if the three of us had the pleasure of having a group of prospective students in front of us, in fact, some of us might be on the chat with us on this event live right now, there could be some prospective students. To those prospective students that are out there, what advice might you have for them as they think about this amazing journey that they could embark with us?
Yeah, that's a great question. I think the biggest advice that I would give prospective nursing students today would be to always remain adaptable and flexible. as nurses, like I said before, we wear a lot of different hats, and in a moment's notice, we may have things that happen where we have to quickly change that hat. For example, when the COVID-19 pandemic struck, nursing education literally changed overnight. While we have learned a ton over the last 14 months, we still continue to learn, and things are always evolving and changing day to day. If a student is not somebody who can adapt or change at a moment's notice, nursing is probably not for them. They're going to struggle to be able to be successful if they really just can't adapt and be ready to make that change at a moment's notice. So you have to just sit back as a nursing student and as a nurse and really assess what's going on and decide how you are going to respond to it. Stress and anxiousness only make things more tense and more uptight. And while taking a deep breath and kind of deciding on how you want to respond in that moment of crisis in a positive manner shows more leadership and character. We need nurses who are wanting to lead and make things better for health and for our community and for the world in general. So to be problem solvers and change agents who advance health and healthcare forward while being able to be flexible and adaptable are probably the biggest pieces of advice. You can teach just about anybody, skills or whatnot, but you can't teach some of those innate how you respond in a situation type soft skills. So that's what I would say. Biggest advice for nursing students.
That's a good advice. Absolutely.
Yeah.
Agility, a very much needed competencies for nurses. That's for sure. I have one last question. I'd like to offer it to Melissa. Melissa, when you think about the last 14 months, which our lives has completely changed, this pandemic has been very impactful. You think about that and you think about the impact, and Ron was just mentioning it, that we've learned so much in the last 14 months and we've had to make so many changes and the likes. Considering that, and if we were to put our futuristic lens, if you will, how would you see nursing education changing in the future, and perhaps mainly because of the impact of COVID-19? Any thoughts you'd want to share?
Yeah, I think some of the changes we've had to make, we're forced to make to get through this period, are probably things, even in our personal lives that are changing for the good in some ways, so that we can be more flexible and adaptable and resilient in the future to changes like this. We've really had to rethink and think hard about how we are delivering education, whether it's the methodology or the mode, online, virtual. We've had to think differently about simulation, even to think about how we're doing that face-to-face, but then can we do that virtually? How we can meet the same outcomes and have the same quality end result for nursing students as we would if we were able to do it the way we could before the pandemic. So experiences with preceptors, experiences with nurse leaders, we've had to think about different ways to do that and challenge ourselves to be okay with that, plan it, develop it, implement it, and evaluate it for certain, so that we can make sure that we're getting those quality outcomes. We've also had to have some conversations, not just with our students to offer reassurance, but also with employers, because students graduating, like our graduates in December of 2020, they had the large majority, at least 11 months of it was during a pandemic. And so when they weren't able to spend as much time with the preceptor or with patients, and we had to make some adjustments, such as like in Lewistown, Montana, we used the Montana Sim Truck. We had the Sim Truck arrive on site, and students did, repeated simulation activities with that experience, with simulation experts there. And that replaced some time that they would have gotten with preceptors. But the clinical areas were overburdened at the time and couldn't have as many students. And so we've had to be creative. We've had to look for resources in other ways, whether that's on the clinical side or financial side or those kinds of things. So we've had to be more resilient in that way and creative and innovative. And so those are our challenges. And then I think the other part of it is the human side. You know, it's really not possible to just tend to the skills and the simulated experiences and the tasks of learning to be a nurse or growing as an experienced nurse in a graduate program. We have to tend to the people that are in that experience. That includes students, but it also includes faculty and staff and those supporting them. And so resilience is part of our discussion often. You know, how we're taking care of ourselves is critical in nursing. And so this is a good reminder that we have to be doing that. We have to be looking out for each other, looking out for our neighbors and community members as well. So I think tending to how we're doing education, but also who's in it, who's in that interaction with education. So I think that's a big part of it as well.
Thank you so much. I am so grateful to have been able to spend this time with you both today, and grateful for all of what you do. We need you. We need more people like you, and hopeful that our listeners were as excited as I am as I walk away, knowing that our nursing education is in good hands. So thank you, Melissa.
Thank you.
Ron.
Thank you so much.
You bet.
Thank
Thanks for joining us today, and to everyone for listening and sending in your questions. To learn more about our initiatives, our programs, our services, and ways to give, please visit providence.org. And also make sure to follow us on social media under Providence on Twitter and at Providence Health System on LinkedIn, Facebook, and Instagram. Thank you so much.